Presently working in older persons rehab in Dublin. You may recognise me from ISTO of 2019 and 2020. And I also had previous experience on the UCD Trampoline Club Committee in 2015 to 2017. I am a level 1 judge and coach, and you may also recognise me as a mediocre intervanced competitor. Why won't that work? Okay, we'll just have to click. Clíodhna, I'll hand it off to you.
Hi guys, so I'm Clíodhna. I graduated from UL in 2019, and then immediately afterwards I moved over to Scotland to start working here. So since then I've worked on wards and medical wards in an outpatient clinic, and at the moment I'm specialising in paediatrics, so anyone under the age of 16. Obviously, I've been part of UL Trampoline Club. I was their events officer in 2015-16, and then health and safety officer in 16 and 17, and an unofficial physio for them kind of throughout my 4 years in university. I'm also a trainee rebound therapist, so that's using trampolines as therapy, as physiotherapy for children and adults with disabilities. I would say I'm subpar into advanced trampolinist, but my claim to fame is that I was 3-time ISTO cheerleading champ. So that's a bit about me, and I'm going to hand you back to Emily for a little bit.
Right, so we're going to discuss kind of the scope of this presentation because, you know, legally myself and Clíodhna need to cover ourselves here. So this presentation is designed to just be like a little bit of guidance and to kind of help you be better informed as to when you need to seek advice from a professional, whether you need to see a doctor or a physio, things like that. Hopefully it'll help you build insight into anatomy, biomechanics. Doesn't need to be super in-depth, but just something that can kind of inform your strength and conditioning, your training, your injury prevention and stuff like that. No pun intended, but this should be a jumping off point. So we're just going to be dipping the toe into a couple of these concepts, but it's not going to be, you know, it's not going to be all the information that you need. This is just some general advice as it pertains to trampolinists, and it is not, you know, prescriptive or a gospel for all situations. It will be evidence-based, and it will be enhanced with some anecdotes from myself and Clíodhna. Just to note, you may have realized from our kind of bios, we're not experts in this field. We are exercise professionals, and we just have personal history and interest in trampolining and gymnastics. This talk is not designed to be an alternative to seeing your own doctor or your own physio for any injuries or niggles you might have. So yeah, and like I said before, it's not all the information you need to be fully informed on these topics. It's just kind of to give you an idea as to what's going on. So further to that, a little bit of friendly advice. Like I said, we're experts in clinical exercise, so that's kind of injury prevention, rehab, things like that. If that's what your goal is, you should do it under the guidance of a physio if you want to have the best results. All the injury prevention in the world isn't going to stop freak accidents and injuries happening. You know yourself, sometimes the strongest people with the best, you know, body prep and all that, they can still fly off the trampoline, things like that. There's big forces going on. So, you know, sometimes injuries do just happen. In general, if something hurts, see a professional. Better safe than sorry. Don't wait until it's stopping you from performing. And be aware of your own limitations. Like, I'm sure many of you here are not physios and you're not, you know, medically qualified or anything like that. So just know when you need to seek advice from someone who has that professional knowledge. And the biggest thing, utilize student physios in your own institutions. Myself and Clíodhna were basically unofficial physios for 4 years when we were in university, and generally people are quite happy to put their knowledge into practice. So people like to help. So use the students if you can. So this is a little just overview as to what we're going to talk about. So I'm going to start off with just a little bit of basic anatomy. Then we're going to go over to Clíodhna, and she's going to talk about some forces and some very kind of basic, friendly biomechanics. Don't be too afraid of it. And then she's going to go through some common complaints. And we are going to finish up with me again, and I'm going to be talking about urinary incontinence. I'm really excited to talk about it. So, right, let's kick it off with some anatomy. So anatomy is massively complex. Anyone who studied kind of anatomy at any level will understand that there's a lot to know and you can always know more, basically. So, but understanding the body as a whole system and how it works together is really important for anyone who's doing anything with a human body. So if you're coaching or if you're devising a conditioning program, anything like that, basic anatomical knowledge is really important. And it can be a great adjunct to coaching. And you can really use it to kind of empower your athletes and kind of encourage bodily awareness, which can then help them perform better. So obviously I can't do the whole human body. So I'm going to be covering just the upper back and neck and kind of posterior shoulder, and then the lower limbs as well. Those are kind of the main areas where people have kind of pain and issues. So jumping right in, we'll go for the upper back, neck, posterior shoulder, this kind of general area in the picture here. So there's a huge amount of joints at play here. So obviously you have the 7 kind of cervical vertebrae in your neck, and then you have your scapula and all the bones kind of in your upper limbs. So there's a lot of joints there. Generally when if people have pain in this general area, it's usually because of their traps. So the trapezius muscle, you can see it's this kind of big muscle here. So it has upper, middle, and lower fibers. And a lot of people will have kind of tight traps and they'll be kind of tender on palpations. If you kind of squeeze someone's shoulder, it'll be probably pretty sore. A lot of people will have kind of trigger points or muscle spasm in these areas. And they're not necessarily, huge problems. They can just be a little bit painful. Then we also have the rhomboid. So these are these muscles here that kind of go from your spine to the edge of your scapula. So these are also kind of another big muscle group here. And again, people can have a lot of like tenderness and tightness there. And yeah, the pain can be kind of annoying, but not really indicative of anything too serious. But in general, think of these kind of muscles when you think of like whiplash injuries, which maybe you don't think of when you think of trampolining, but any kind of sudden twisting, excessive flexion of the neck. So like, think about it, like if you suitcase, like if you have your chin stuck onto your chest, that can be really sore and you can really kind of aggravate all the muscles at the back of your neck. And you probably haven't done huge damage, but you're probably going to be in quite a lot of pain for a couple of days to weeks. So those are the main ones there. We're going to talk mostly about the anti-gravity muscles of the lower limb. So generally, when I was in college, we used to focus a lot on the anti-gravity muscles. So generally those mean like the ones that help you stand up and stay standing. But in the context of trampoline, they're the muscles that are literally helping you jump into the air. So your anti-gravity muscles are most commonly referred to as your glutes and your quads. But obviously in trampoline, you're going to be using your calves as well a lot. So we'll look at this a little bit more in detail. So there's a lot of stuff going on here, but we're just going to focus on the main muscle groups. So when we think about the muscles of the hip, we're thinking mostly about the glutes, the hamstrings, and the quads. And these are all muscle groups. So they're not 3 muscles, they're just 3 groups of muscles. So if you think of your glutes, you're going to think mostly about hip extension. So that would be kind of when you're pushing your belly button forward. They also play a role in hip abduction, so bringing the thigh away from the body. Then the hamstrings, maybe you don't think of them as a hip muscle, but they do play a little bit of a role in hip extension, but mostly you think of the hamstrings as doing knee flexion. Then in the quads, again, you might think of these more as a knee muscle, but they do have a role in hip flexion as well. Right, and then we're going to talk about the muscles of the knee. So hamstrings and quads, we've kind of discussed those already. Those are the main ones at play. But also your gastroc, which is one of the muscles of your calves, it does cross, it crosses the knee joint as well. So it's one that you also need to think of. So it's primarily involved in plantar flexion, so pointing your toes, but it's also involved in knee flexion and knee stability. So it's an important one to kind of pay attention to as well. And then we'll have a brief look at the ankle. So similarly to our first kind of section, the ankle joint is very complex. There's a lot of joints at play. There's a lot of, tissues involved. There's a lot of tendons, ligaments, all things like that working together to try and maintain stability, and while it gives you movement there. So the ankle, primarily you have dorsiflexion, so that's toes up, plantar flexion, pointing your toes, and then inversion and eversion, so turning the soles of your feet towards and away from each other. Main thing here, your Achilles, so that's obviously the big tendon at the back of your heel. It generally, if it's going to rupture, it's going to rupture on takeoff, not on landing, which is important for us just to consider. And generally, if it's going to go, it's because of overuse. So gastroc and soleus are the two muscles that make up the calves. So soleus only crosses the ankle and gastroc crosses the knee and the ankle. Basically, all that means is that if you're strengthening or stretching your calves, you need to do it with both your knee straight and your knee bent. And prophylactic ankle taping can be really useful to prevent ankle sprains and other injuries. So if you are finding that you're recurrently kind of injuring your ankles on the trampoline, it mightn't be any harm just to put a bit of tape on them, just even for your own kind of confidence when you're training again. And if anyone would like any help with that, I'm quite happy to guide you there. So I'm going to hand it off to Clíodhna. She's going to talk a little bit about biomechanics.
Yeah, so this is essentially going to be trying to understand the forces at work and how they impact your body and how your muscles are reacting. And we're going to do that through the 3 phases that you go through when you're competing or training on trampolines. So you've got your takeoff, your flight phase, so when you're in the air, and your landing phase. I think Emily's
Sorry.
So a very quick bit of physics. So trampolining is based on Hooke's law. So that's the reason we can go high in the air when we're trampolining, is that Hooke's law of our spring compressing. So the law states that the force needed to extend or compress a spring by some distance scales linearly with respect to that distance. So essentially what that means is the more you push down the spring, the higher you're going to go. So the harder you push down, the more the spring's going to compact, and then that's going to spring you higher into the air. However, there's obviously a limit on this. So a spring can only compress so far before it'll break. So that's the point at which breaking springs happen. And this happens when the force is too high on the spring. So heavier weights, if you've just pushed more force through your muscles, if you've done a really high jump on the previous jump and you're landing heavier that time. So what determines that force then that you're putting into those springs is mostly based on your kinetic energy levels. So your kinetic energy is that formula you see at the bottom there. So it's half of your mass times your velocity squared. So this is the speed at which you're descending and your weight. And then that's your kinetic energy force that's going into the spring. And then you've also got your own force that you're putting through your limbs. So you're pushing further energy by pushing through your muscles. With your kinetic energy, it's at its highest point when you land on the trampoline, because obviously you're gaining that energy as you come down, and it's at its lowest when you're at the peak of your jump, because when you run out of that energy, that's when you're at the top, and that's why you come back down. So when you're at the top of your jump, you no longer have that energy from the bed, and that's when you need to start using your muscles to do your skills. And that's a lot of the time when people start doing somersaults by kicking off the bed and things, it's because they don't have that muscle strength to do it without the bed's energy. But we'll talk about that a bit more in the takeoff phase. Sorry. Perfect. So when you are taking off, your muscles are doing 2 things. Firstly, they're absorbing the energy from the bed. So that energy that you've just put into the bed when you've landed, your muscles are trying to take that back into your jump. And you're also pushing off with your muscles to gain more height. So for this, you're going to be using your plantar flexors of your feet. So to point your toes, as Emily said, that's your gastroc and your soleus. You're going to be using your quads to extend at your knees. So that's getting your straight legs. You're going to be using your glutes to extend at your hips. And you're going to be using the muscles of your shoulders, because you're obviously bringing your arms up. And the research shows that that arm movement does give you a significant increase in the height that you jump. The other little tidbit is we want you to have tension once you've left the bed. We like, that's what all your coaches will say is hold in or keep your core tight when you've left the bed. But it's important not to do that until you're about to take off, because if you keep that tension, if you start tensing too soon, your muscles can't absorb that energy from the bed. So you're actually going to stunt your own bounces. Because you're not allowing your body to absorb the energy. So it's shown that if you wait until as late as possible to point your toes and straighten out your knees, you're getting the maximum input from the bed, so from the energy you've put in on your last landing. So that is your takeoff. When you are in the air, it's more about your own body's ability. So you're generating this energy using your muscles. So you no longer have this kinetic energy from the bed. You'll be getting some more energy as you come down. So this is why you do your skill at the top of your bounce. Obviously, the amount of energy you need from your muscles is majorly dependent on the skill you're doing. So your muscles aren't going to be as activated. You're not going to be recruiting as many things to do a tuck jump as you are to do a double back. But it's important to acknowledge that in every skill, you do need solid core strength to hold your stability. You need your neck strength to be good so that you're not shaking your head all about the place. Your shoulder strength so that you can hold your arms up in the sustained position. Your legs, if you're tucking up in any position, if you're piking, that's also your lower abs. So there's a huge range of muscles used. And what it's really important for this point is if you're a coach and you're trying to progress someone to a new skill and you're getting them to do it over and over again, and you're seeing them make the same mistake, and you're seeing them not able to lift their legs or activate and take them off the bed and see where their weaknesses are, keep on doing that skill over and over. It's not necessarily that they can't figure out what to do. Sometimes it's that they know what they're supposed to do, but they just don't have the strength. So it's really important to, in this phase, to look at what your athletes are doing. Even look at yourself, look at a slowed down video of your skills and assess, are you switching on the muscles like you should be? Can you see if you're tensing, or are you just kind of flinging and hoping for the best? And then landing. So for most of us, we think kind of injuries occur when we land. Sometimes this is those freak accidents of you've flown completely off course in the air and you land funny because of it. We're not going to stop those. But it's very different to landing on solid ground, because as we said, the bed's elastic, you're putting force in, it's absorbing your force. But the load on your body is 13 times your body weight. So that's your force as you land on the trampoline. So for me, I know that's quite a considerable amount of force to be putting through my joints. And if I don't land in the correct way, my body isn't putting that through the right joints and the right muscles. And that's when injuries can occur. So as Emily said, you've got all these big muscles in your legs. So you've got your glutes and you've got your quads, and they're energy absorbing muscles. So it's really important to utilize those muscles and not your back muscles to take in that shock from when you hit the bed. So there's not a huge amount of research on this in trampolinists. There's quite a lot in gymnasts. So we look at stiff landings versus soft landings. I'm going to have to look at my notes to get the exact measures on this one. So your stiff landings are if your knees are bent less than 63 degrees. So you only have a very slight bend in your knee, so you're quite tensed. For maximum absorption of energy, you want a soft landing. So your knees are bending more than 60 degrees, 63 degrees. So in this picture, it's about a 90-degree bend. It's not always possible to get that far, but you're hoping to get at least 2/3 of that when you're landing on a trampoline. It's also shown that landing with your heels first is better for absorption, and more flexion at your ankle than at your knee. So as we discussed, those muscles at the back of your calves, stretching them so that it allows your ankle to bend enough to get your ankle bending more so that you can get into this position of a squat. Because a lot of the time that's actually what limits people in their squat depth is their ankle range of movement. Perfect. So that is on that. So I feel like I've talked for ages, but the next thing we're going to go through is just some common problems. A lot of these arrive from compensatory mechanisms, which is, I've touched on it a little bit, but we're going to explain a bit more what I mean by that. And then we've just picked 3 kind of things that came up through our experiences of trampolining, and also just some things that people have said to me when asked, what do you associate with being the common injuries from trampolining? So compensatory mechanisms. This In a general sense, it's an innovative way that your body adapts to misaligned musculoskeletal movement patterns. What that basically means is if you're weak somewhere, your body will use something else to make up for that. If you don't have enough range of movement in one place, your body will use somewhere else to make up for that. For an example, like if you don't have the movement in your ankles, your knees might bend more, or your back might take more of the force. So looking at the different phases that we've just went through, we notice that there's quite a lot of different muscles at play and a lot of different joints that are impacted. So if at any point in those mechanisms, if in your takeoff, if in your landing, there's anything that's not strong enough or not stable enough to do the job it needs to do, we compensate with other muscles. So if your core strength isn't enough to lift your legs during a somersault or a backdrop, what a lot of people will do is arch their back extra. Or similarly, if your range of movement in your shoulder isn't enough to get your arms fully up straight, what people will do is arch their backs further to try and get that straight feeling that we encourage so much. So touch on kind of at each of the points when the overcompensation can happen as we go through the common injuries, because it's a bit easier to do it that way. So shin splints. This is kind of a coverall term for pain at the front of your lower leg, so your shin. It's still kind of unknown what causes this because it's such a broad term. In trampolining, a lot of the time it's because the calf muscles are quite tight and they're pulling on the bones at the front of your leg, and that's what's causing the pain. If you think about when we're taking off and when we're absorbing the force when we're landing, we're taking a lot of pressure through those muscles and we're kind of constantly squeezing them. So when you're pointing your toes and pushing down, those muscles are getting shorter in the back of your calf every single time. So every single bounce, you're contracting that muscle. The only time it's getting a little bit of a stretch is when you're landing on the trampoline, your heel's landing first, which isn't long enough to make up for how much you're tightening it. So these muscles are getting tighter and tighter and tighter. And that's why it's so important to take your time to stretch your muscles regularly. So not just at the end of a training session, should be daily or up to 5 times a week, holding the stretch for 60 seconds for 3 times in a row. But when you're doing these stretches, it's not that you're pushing into that, oh, this is really, really, really painful. You're just getting to the point of discomfort and holding it there. As Emily mentioned, it's also really important to be doing those with your knees bent and your knees straight so that you're getting the gastroc and the soleus. If you look these up, there's 1,000,001 different stretches. Different people find different ones work. If it's over the edge of a step or sitting on the floor with the towel around your foot, pulling your foot towards you. There's so many. I'm happy if you want to get in contact to give some examples or things, just let us know. The other thing that can cause, the calf muscles to be tight is your poor landing mechanisms. So if you're trying every time to get that ankle to bend, because your bodily force will push it further than it really feels comfortable, and you're doing that over and over again, and that extra loading can cause the pain as well and can cause that tightness as well. So it's the same approach. It's being caused because the muscles aren't flexible enough, so it's going to be the same stretching that's needed for that. So ankle pain. It's very, very complex. There's lots of different things that cause ankle pain. If you've had previous injuries that you haven't fully rehabbed, that's a huge thing that happens. It can often happen because especially if you've kind of gotten your rehab through health service, unfortunately, physios will tend to discharge at the point of if you're walking independently, if you can stand on one leg, sometimes if you can hop. They won't necessarily continue to get you back to an elite sports level. If you're in a private physio, that might be more likely. But what can happen after you've had an ankle injury, or just some people biomechanically, their makeup, their muscles, their tendons are a bit looser than other people's. So what can happen is your ankle isn't as stable as it should be. And every time you run or every time you jump, it's getting a little bit of extra force. So if you can see that picture there where you're rolling your ankle, you've got all those little tendons and ligaments highlighted, and they're what holds it in place. But if yours are a bit weaker because you've torn them or because you've sprained them or just because they are, that might be happening to a small degree every time you land because your ankle doesn't have that stability and that strength. We can do a certain amount to build that up. You can do lots of proprioception work. So that's things like standing on one leg with your eyes closed, or standing on one leg while you're moving your other leg and your arms and just trying to get that ankle stable at a higher level using things like wobble boards. Stand on one leg on a wobble board, eyes closed, one leg on a wobble board. If you can do that, you're like top level, you should not have ankle problems. The other thing you can do though, if it is, you know, a genetic thing that you just slightly looser ligaments, as Emily said, strapping, taping, supports are available, and sometimes that's just the best option. They're the only taping really that has been shown, and the only joint that taping does help and does help prevent injuries. So as Emily said, get in touch for that one. The other area of pain that you can have at your ankle that's quite common is the back of your ankle, so your Achilles tendon, which is where your calf muscles are attaching into your heel bone. So this is most often injured. It's torn. It can be torn when you're taking off because you're pushing through more so than when you're landing. But another thing that can happen there is inflammation of that tendon, which usually happens from overuse or sudden increase in training amount. So just because of COVID, this is a really important time to be aware of this. You've probably all been off training for quite a while. Don't expect to go back and do what you used to do. Don't expect to go back to that same level. While you might feel physically able for it in terms of fitness levels, your joints haven't been doing the same thing, unless you've had access to a trampoline, maybe you have. But that's a lot of pressure to put through your joints when they haven't been doing it. So it needs to be a slow build back up to it. Another time it happens is around competition times. Some clubs will put on extra training coming up to a competition, so your training load's going to increase that way. But also if you're doing your routine more and more regularly, as opposed to just, you know, practicing one skill, you're going to be doing higher bounces, you're going to be putting more force through because you're obviously going to be trying to perform as best possible. And there's research that have shown that there's increased energy output at competition and even at warm-ups and competition compared to normal training sessions in elite male athletes. So it's just something to be cautious of. Coaches as well, be aware. You know, if for some reason there's less people at training one day, just be aware that people are still getting their breaks from the trampoline, aren't just continuing on, because that is just a sudden jump and it can have negative impact. So your last common complaint is back pain or back spasms. Again, back pain can be complicated. However, the back is just another joint. So a lot of people kind of, unfortunately, historically, there has been this thing of if your back hurts, you don't move, you lie in bed, you take to the bed and you let it pass. You take your paracetamol and you rest. More recently, it's been encouraging to move more when your back hurts, to stay mobile, to not walk it off, but stay as mobile as possible. This does not apply if you've flown off the trampoline and landed flat on your back, but this is more for kind of like niggles in your back after training sessions. This is probably the one where overcompensation is the most prevalent. It's often due to poor core control. So because your tummy muscles can't hold you, because your core muscles can't hold you in the most upright position, your back muscles can tend to compensate for that, and you hyperextend, so that really arching your spine. It can be seen on a straight bounce. The best way to watch people see if when they raise their arms, are they in a neutral spine, or are they really overextending that back? And when they land, is the same thing happening? Are they landing with a nice kind of straight back, or are they really over exaggerating the straightness of their spine as they land? Because what that can mean is that they're taking the load through their back muscles instead of through their leg muscles. Again, coaches, look at what your athletes are doing. Don't keep trying to force a skill that's not happening. Consider why. You know, look, right, are they not look at their takeoff. Are they not pushing through their feet? Are they extending really quickly? Is that because they're not enough movement to sink deeper, so it's too sore for them to actually sink into the bed and they've got to straighten up faster? Or is it just because they've not got the strength in their legs to feel a real push off? Look at those type of things. Look at their back when they're doing skills, look at how much movement they've got in their shoulders, and take them off the bed. So strengthening is just as much a part of training as is strengthening and flexibility, as is time on the trampoline. And I think for university clubs especially, this is something that we can tend to not do so much of, especially those of us who are more recreational about gymnastics. It's really important that we still include core in every training session. Really, it should be noted that it's a part of trampolining, that it's necessary if you want to progress, if you want to do the harder skills. You need to have your strength and you need to have your flexibility, or chances are you will end up with these niggles and these complaints, because that's how it happens. So I'm going to pass you back to Emily now. Oh, sorry, I'm going to do a takeaway, but I think I've just covered that. Yeah, so that's fine.
Alrighty, guys. So I am going to be talking about urinary incontinence and female trampolinists. I apologize in advance. The language around this is not particularly gender inclusive. Obviously, not everyone who experiences incontinence on a trampoline identifies as a woman, but unfortunately that's just the language of the research. So apologies for that, but here we go. So we're going to talk a little bit about pelvic floor anatomy to just kind of understand what's going on there. So if you have a look at these two diagrams here, so the top one is if you imagine looking down at your feet, kind of looking down into your pelvis, so like it's a bowl, and then the bottom photo is from the feet up towards the head. So the primary function of your pelvic floor is just support for your pelvic organs. So your bladder, your rectum, vagina, urethra, and the uterus. It kind of acts as like a sling, and it works with your abdominal muscles as well, just to kind of keep everything in place. It's also important role is to counteract the forces of increased abdominal pressure and of ground forces. So if you think of increased abdominal pressure, anything that kind of would move your diaphragm down will cause increased abdominal pressure. So like a cough, a sneeze, laughing, things like that. And then ground forces, so like if you're jumping, things like that. So a well-functioning pelvic floor is really important for everyone. It helps to maintain continence both of bladder and of bowel. So we're going to be talking mostly about urinary incontinence. So urinary incontinence is any involuntary loss of urine. Stress urinary incontinence occurs when urine is lost because of additional pressure on the pelvic floor. So like we said before, kind of jumping, coughing, sneezing, things like that. Then anal incontinence is any involuntary loss of stool or wind. We're not going to talk about this as much, but it is still very prevalent in the sport. This has actually been quite extensively researched in trampolinists, and some studies report over 80% of participants say they experience some of these symptoms. So, right, we're going to talk about leakage and trampolinists. So a theory was put forward in the 90s that physically fit women have a strong pelvic floor as a result of regular training, thus preventing urinary incontinence. So you would think, if you're always, putting your pelvic floor under stress, like progressive overload is how the rest of our muscles get stronger. So they thought maybe it was the same with the pelvic floor. However, this doesn't really seem to be the case. So there's newer thinking now that if you're constantly loading your pelvic floor, you can actually be causing kind of structural changes. So like the muscles and the tendons and ligaments are lengthening because they keep having this kind of downward pressure on them. So if they're lengthening, they don't have that kind of tensile response to tighten up again and like maintain your continence there. So in general, trampolinists don't have weak pelvic floors. They have sufficient pelvic floor function to prevent leakage during pretty much every other daily activity and during most other sports activities. And trampolinists may actually have better strength and endurance of their pelvic floors compared to fit and healthy controls. It's just that the sport demands a lot of your pelvic floor. So there's been research into the effect of the urinary continence on the athlete. So one study did a pad weighting test. So basically they would weigh a pad before and after a training session. So the athletes were instructed to empty their bladder 2 hours before training, drink half liter water, and then not to go to the toilet again. They did 15 minutes on the trampoline, and the pads were weighed pre and post, and they completed this across 3 days. And obviously you can see the range of leakage there. So it's quite wide. Like some people have a lot of leakage, some people maybe don't have as much. But some interesting kind of take homes from that study was that there was no positive correlation between the amount of leakage and the use of sanitary pads. So a lot of the athletes were using sanitary pads to kind of catch any of the leakage, but just because you're leaking more doesn't necessarily mean that you're using pads. And there was no positive correlation between the amount of leakage and embarrassment. So some people were leaking not very much, but they were very embarrassed by it, very concerned with it, and other people weren't. So there was also, very interesting, no significant correlation between the amount of leakage and the strength of the pelvic floor when it was measured. So they can measure the pelvic floor strength by, basically they kind of put a probe into the vagina and that you can just see how much force it can exert. So obviously the main effects of urinary incontinence are going to be embarrassment. Some people see it as a real kind of hygienic issue. They feel dirty, and socially it can be an issue for people. People can avoid skills where they experience it, and this can obviously contribute to drop-off rates, which is unfortunate because we want to try and keep as many girls and women in sport as we can. So I'm going to talk about some of the risk factors here. So people who have some of these risk factors might be more likely to experience incontinence while they're training. So constipation, obviously you're putting more pressure on your pelvic floor. Inability to stop a stream of urine. So again, you don't have that kind of contractile strength. Increased BMI, just because again, you have more pressure on your pelvic floor. Parity, so have you been pregnant? Have you carried a child? That's going to put a lot of pressure on your pelvic floor. And previous pelvic surgery. So again, that's going to result in some kind of trauma to the pelvic floor. So then the trampoline related risk factors. So elite, like the level of performance. So people who are at an elite level of sport are generally more likely to experience it. Obviously the impact level of the sport is going to be big. So gymnastics is high impact, swimming is low impact, running is medium impact. But even within kind of the gymnastics disciplines, trampoline would be probably one of the higher levels of impact. People who are training more often during the week and for longer, and people who have been training for a longer number of years. So it kind of makes sense when you link it with like level of performance. Someone who's been training, 4 times a week for 10 years and is performing a 10 somersault routine is probably going to be more at risk of this than someone who's been training once a week for 2 years and is doing a 2 somersault routine. I don't know, things like that. This is generally more prevalent towards the end of a training session. So again, a little bit of fatigue can be the impact here. And double somersaults were also rated as being contributory to this, and some new skills. So any kind of new demand on the body is also going to have a new demand on your pelvic floor. So we're going to talk a little bit about how this happens. So the increase in abdominal pressure during the physical activity, like we said before, it can kind of cause lengthening and structural changes to the pelvic floor. And there is thought to be kind of a pressure threshold of the pelvic floor. So it can maintain continence up to a certain point, but then once the pressure is too much, then it can't maintain continence anymore. Hypermobility disorders may play a role here, again, because you have lengthening in those structures. So it's kind of been put forward that it might play a role here. Muscle fatigue, as we mentioned before. So if you have a really long training session, maybe you can maintain your continence for an hour and a half, but that last half an hour of training, it could be when you're really struggling. So muscle weakness and a slower response of the pelvic floor due to continuous mechanical stimulus makes co-contraction of the pelvic floor more difficult to attain. So what that means is basically if you're constantly training, if you're constantly jumping, your pelvic floor has a lot of kind of pressure on it. It's a lot of stimulus. So trying to coordinate the contraction of your pelvic floor and your abs can be difficult, and you need kind of both of them to be working to maintain continence and to kind of keep everything tight, and even just to maintain core stability. So different studies have suggested different things, but some of them suggest that if you have any kind of incontinence when you're an athlete, that this can carry forward into, the rest of your life beyond athletics. But there are also studies that suggest that people, like former athletes, have the same kind of prevalence of incontinence as people who weren't athletes. So more research is needed there, but basically don't panic if this is you that you're experiencing incontinence. Don't panic, basically. So a couple of strategies that came out of the research. A lot of girls were using pads to soak up leakage. People were emptying their bladder before training or competition. Both of those are relatively harmless kind of tactics to prevent incontinence. Where it gets a little bit more damaging, potentially, people were limiting fluid intake before training or competition. Obviously, we all know hydration is massively important for your muscles and to, keep yourself performing at a high level. And people were avoiding skills that were triggering leakage. And I mean, for some people that's going to be okay, but if you're really trying to progress in the sport and learn new things and kind of challenge yourself from an athletic point of view, that's going to hinder your ability to progress. So what can we do? So we don't necessarily need to normalize it. It doesn't have to be part of the sport. So while it does affect a huge amount of people that are participating in the sport, it doesn't affect everyone. And there are definitely things that could be done to help people make it less bothersome on people, and like maybe even help to resolve symptoms. So hopefully this will encourage some open conversations among coaches and athletes. And perhaps there's a little bit of a cultural change needed here, because people generally don't like to talk about it. Excuse me. Potentially shorter coaching and training sessions might help. It might be better to do kind of a shorter, more intense training session rather than a longer drawn out one. I would encourage people who are experiencing any kind of incontinence when they're on a trampoline to discuss it with their GP if you feel comfortable doing that. And they might refer you on to an appropriate specialist, be that a gynecologist, a urologist, or pelvic floor physio specialist. Pelvic floor physio specialists are considerably more qualified than myself or Clíodhna to deal with these kind of things. They can guide you a lot more than we can. And hopefully if people have access and resources to kind of healthcare to help manage the symptoms and reduce the bother, like if we can try and make it so that less people are experiencing the symptoms and maybe people are less put off, or even they're not thinking about it as much when they're training because you have so many other things to think of. So yeah, so I have a couple of take-home messages. So strengthening and flexibility outside of task-specific training is essential for optimal performance. So conditioning is really important. Like Clíodhna said, you need to make sure that you have the strength and the flexibility and the mobility to actually do the skills properly, and trying to avoid all of those compensatory mechanisms is really important. Prevention is better than cure. Again, like Clíodhna said, try and address your weaknesses and potential sources of injury before they become an issue. Don't forget about the muscles that cross two joints. Just think about how you're strengthening them, thinking about what positions you need to strengthen in. And if anyone brings home anything from this presentation, please don't use conditioning as a punishment or as a consequence for like falling or touching the blue or anything like that. Conditioning is so essential for healthy athletes and for, achieving goals and progressing in the sport. If you, as a coach, it's in your interest to have your athletes see conditioning as a positive and see it as a tool towards progression and a tool to get them where they want to go. It's not, oh, people hate doing their conditioning, so they'll do it when they fall off. Like it doesn't make sense, basically. So we're going to take some questions. Clíodhna's going to take the lead here.
So I've got a few from Instagram from earlier, so I'm just going to go through those first, but if anyone's got anything extra, just throw it in the chat and we can do our best to answer them. So the first one was, is it okay to crack bones, specifically in your back? I suppose this is kind of, it's quite vague. So bones crack, it's not your bones that are cracking, first of all, it's just gas bubbles popping. Bones crack, or not bones crack, things crack if you move your neck, if you move your back. Sometimes you'll just hear that. You shouldn't be putting forcible pressure to do it though. So if you feel like I need to crack my back, if that doesn't happen naturally, if you're getting someone to kind of like stand on your back or push heavily that is not a trained professional to do that, I do not recommend that at all. Some people do find osteopaths and chiropractors can help them. If that's your thing, I'm not there to say it's not, but do make sure they have your relevant qualifications. Do make sure that you've not got any injuries, you know, any fractures in your vertebrae. If you've had any recent falls off a trampoline and you've got back pain, if you've landed on your back, don't try and go get your back cracked. Get things checked if the pain is ongoing, and the last thing you want to do is have someone cracking your back if you've got a potential fracture or anything like that. So it can happen naturally, don't force it, would be the approach that I would have with that one. And the next one is, any recommendations for knee strengthening exercises? It depends on the level that you're at. So if it's kind of rehabbing a knee, what I would be doing is things like straight leg raises. So this is like lying flat on your back, just lifting your leg a little bit and lowering it back down. That is a very basic level. If it's not a rehab and it's just kind of ongoing, that you're trying to build up your strength, functional things for your knee. So things like step ups where you're 1 foot up and you're pushing through that to drive up your other leg and then lowering back down. Things like squats, like tuck jumps on the ground, things that are more related to your sport. So while we said it's important to come off the bed and do conditioning work, doing conditioning work that doesn't incorporate what you do. So, you know, doing kind of a load of floor strengthening work for your quads and for your hamstrings is necessary. It's necessary to do quite a bit, but it's also necessary to include functional exercises. So things like squats are going to help with your range of movement and your strength for when you're landing. Things like squat jumps, similarly, you're practicing that landing, you're practicing that absorbing force. To whoever asked that question, I am quite happy if you want to send me a message about anything specific. We've got our emails attached on here, or if you have me on social medias, you can pop questions, and I can give kind of a more detailed program. I don't have any problems with that, to give you like a little exercise program. The next one in relation to injury is warming up / stretching beneficial just before competing. So I'm taking that one to mean like immediately before you get on the bed at a competition. I would hope that everyone is doing some sort of dynamic warm up. And obviously you're doing your on the bed warm up, but then if you're coming off and waiting, you know, while other people are doing their routines while you're warming up, or while you're waiting for them to do their routines, simple things like lunges, just standing tuck jumps, heel raises, jumping jacks, things to prepare your muscles so that you're not going onto the trampoline bed cold. So if you've done your last warm up, it could be 10-15 minutes before, depending on how big the flight is, it could be quite a while before you get on that bed again. So just simple things like jumping on the spot, using the muscles that you're going to be using during your routine, making sure they're kept warm. Some people like to do that as well by, you know, keeping a jumper, keeping trackies on before competing. That can be helpful, but making sure your muscles are activated and switched on is really good to do just before you get on the trampoline. Things that I really like are leg swings. So swinging your leg side to side and swinging your leg back behind you is really nice for activating your glute muscles before you get on the trampoline. Again, that's something that we can do like a little, if people are interested, like a little three exercise or whatever program for like just before you get on at a competition. So that actually be quite a good one to do. So again, so I think there's a few that have come through in the chat there.
I might take the one about So I got a private message on
right, we'll let Emily crack on with that.
Asking, is there any research on age and when urinary incontinence may begin to occur? Not that I found in the research. The youngest participants I found in the research were 12, and it was prevalent then, so it could potentially be starting earlier. So yes, be aware of it happening in any age of your athletes, really. But it is seen to get progressively worse after the first period. So just suppose be aware of that.
Massage guns. So I think, again, similarly like to the back crack thing, this is personal preference. They can be used with foam rolling. With massage, the theory behind massage is that you are breaking down tissue and you're stimulating blood flow. So if you've got any inflammation, if you've got any kind of toxins in the blood or lactic acid buildup after a training session, massage in theory can help increase your blood flow to help get those things out of your muscle and filter your blood. The other reason that massage in theory is helpful is it can help lengthen your muscles. It can reduce the tension. Trigger point massage, I've found personally works for me for my traps, so I get quite a lot of tension in my shoulders. Unfortunately, it's something that is really difficult to research, and the research behind it isn't really there. Anecdotally, most people I've spoken to have found massage works for them, have found it helpful. I know through the years I've done quite a bit of calf massage. Massage guns are not something I've personally used. I do have a close friend who is a sports physio, and he runs a clinic and has recently given a massage gun to kind of compare to what he does with his like just hands-on massage, and said he thought it was really good. Said he thought it did as much as he would do during a massage. So that's kind of only anecdotally on it. I don't really have a huge knowledge of the research on them. They're quite a new thing as well. But I can't see why you wouldn't use them with foam rolling. I don't know if Emily has anything to add on that.
So I did a whole like workshop in college on foam rolling, and there's not a huge amount of research behind it. Like, you need to exert massive forces on like fascia and tendons to encourage any kind of lengthening that you're just not going to with a foam roller. So I suppose, like, if you get symptomatic relief from it, that's one thing. And like, I know like the research behind like massage and stuff, but like I still get relief from like a traps massage, so I'm gonna do that. So but if you're foam rolling because you think you're like loosening out or putting more length on like your IT band, you're not. So I suppose just understand why you're doing things would be kind of the main one. I think, yeah, like symptomatic relief, go for it, do whatever you think is good, but yeah, I suppose not everything is scientific, basically. Does that make sense?
Yeah, cool. The next one, revisit muscle tension relaxation of different sections of the body when in contact with the bed to maximize your jump height. Yeah, so from what the research was saying, it's your extensor muscles you should leave to the end. So that's your pointing your toes and straightening your knees. You should do it the latest point possible for you before you leave the bed. So it's obviously the bed dips and rises. So as it's coming to the maximum point of its rise, that's when you should be extending your legs. Arm movements should start happening from when you're at the lowest point. So your arms should be going from the bottom to fully raised with the rise of the bed, if that makes sense. The research wasn't as clear as in terms of tension in your back or your core muscles. I suppose from a stability point of view of your legs kind of absorbing pressure and things, you would tend to hold your core muscles and activate your core muscles throughout the movement, and never really kind of completely relax your core muscles. So when you're landing, your knees are quite relaxed so that you can bend more, you can sink into that. So you're relaxing your knees and your ankles as you land into the bed, and you let it rise as high as you can, and then that's when you're extending all those muscles in your lower limbs. Hopefully that's cleared up a little bit. I think the next one is for Emily.
Yeah, so thoughts on exercises that aim to release pelvic floor muscles. No. Pelvic floor is way more specialized than anything I have done. Yes, there can be issues around pelvic floor. Sometimes it's that your pelvic floor is too tight. It's not releasing enough. But yeah, you need to see someone who's more qualified than me, basically. Sorry. You may potentially need like an internal examination, which I can't do over Zoom. So.
Coaches on how to pace young gymnasts in terms of flexibility and strength, avoiding piling on too much muscle too soon or causing long-lasting damage from overtraining. So really interestingly, actually, I recently learned that if you do a hypermobility test on under 8-year-olds, the majority of them will come back as being hypermobile. So younger kids generally have looser muscles. So what I would say is, similarly to anyone in terms of flexibility, if it's painful when you're stretching, that's too far. So it's similar to what we've said earlier. When you're doing your flexibility training, it should be to the point of discomfort, but no further. Some people's muscles will not be long. It's also really important to note that when kids are going through growth spurts, so when you're kind of in your adolescent phase, your bones will grow faster than your muscles. So kids that could previously do certain things with their flexibility, if they've had a growth spurt, say, you know, over summer, they come back to training, or even just kind of a slower growth spurt, they might find that they're losing their flexibility. And it's actually just that their muscles, so I'm trying to describe this as I can. Your bones grow, your muscles don't actually grow as such, they just stretch as your bones stretch, as your bones grow. So your muscles take longer to adapt to that stretching. And so when kids are hitting those growth spurt points, that's when you need to be aware of it, that you're not going, well, you could do this before, you should still be able to do it, because they very well might not be. Their bodies have changed. And you just do that same protocol of you go as far to the point of discomfort, and that is when you stop. At that age, they might need to be doing more regular flexibility training. It might need to be a bit regressed. So, you know, if you're doing kind of just trying to get the splits, say, that's incorporating so many different muscles in one go. So taking a step back and looking at which specific muscles are stiffer and doing specific stretches for those can be quite beneficial to make sure you're not super stretching certain muscles and then those muscles are compensating for the ones that are stiffer. So breaking down the skills that they need as well, breaking down the points of flexibility is a good way to avoid overstretching certain things. With strength, there's no hard and fast rule. If it's weights related, it's usually a 1 rep max approach that people use. So kind of add on until they can only do one time lifting a weight, say. That's obviously harder to judge when you're doing things with like core stability and holding planks and things. Say if you're doing the likes of a plank, if someone is starting to shake when they're doing a plank or starting to dip their back, that is too long a length of time. Sometimes this is where issues arise in terms of when you're doing it as a group strengthening exercise, because you're saying, right, we're going to do a 30 seconds plank, but some of those kids aren't actually able for that. So what I would advise is watching what they can do. You might need to take time at the start of a season to figure out their kind of levels that they can do, maybe get a strength and conditioning coach or a physio involved to see kind of where they're all at, and then you can do more individualized things. Sometimes timing does work. Instead of saying, you know, you've got to do 20 push-ups or you've got to do 20 sit-ups, having say, right, do as many as you can in 30 seconds with the correct technique is more appropriate for children, because then they're doing it with what they can, as opposed to just losing their form and doing it poorly because they're trying to do it. Muscle takes about 6 to 8 weeks to build, so usually you wouldn't look at changing a program for that length of time anyways, so you'd allow them to build the strength of the program for 6 to 8 weeks, and at that point you'd reassess and make it more difficult, but you need at least that length of time before you make things more difficult and build your strength on from there. That's my extent for that one, Emily.
Yeah, like I think in terms of pacing people for strength, like I don't think you can be too strong, if that makes sense. So I wouldn't, yeah, like you need to make sure that they're strong enough. And I would nearly err on the side of more conditioning than more bouncing, especially for really young kids, because like even just their growth plates are still going. So yeah, obviously what Clíodhna said is all really important. You don't want to overload them too young, but I think especially at a younger age, you probably want them doing a bit more physical prep than you think, because I think when you get kids started in the sport, it's very tempting just to put them on the trampoline for an hour and that's it, and then I'll see you next Saturday. But you really need to be working on the strength and the control of their joints as well.
And another point in that actually is the kind of younger kids, so you're like 4, 5, 6-year-olds, their types of movements that they do in their day-to-day do involve more core stability, so they tend to be doing more kind of like single leg stuff and just in their play. It's more active for their core. But as kids get older and they're doing less mucking about on the floor, doing like they're tumbling or, you know, just mucking about, they're doing less core specific training. So that kind of age group of your 7 to 10-year-olds, they're just day-to-day life activities will drop in the amount that is core strengthening. So that's quite good to just be aware of, and know that at that age, that might be when you need to kind of start upping those specific things.
I got a private question, if you're finished there, Clíodhna.
Yeah, sorry, that was just not
just around core strength because of hypermobility in the back. I wanted to say hypermobility, so mobility and flexibility are two different things. So flexibility is generally to do with muscles, like muscle length, and mobility is to do with the actual joint itself. Have I got that the right way around, Clíodhna?
Yeah.
Okay, great.
You think, Jesus?
So this is really difficult, especially if you are hypermobile, in that your joints just have that extra room to kind of move around. Like, and again, it will go back to all those kind of compensatory mechanisms, because your body is just in those, you know, positions for longer and like more often than maybe a quote unquote normal person who isn't hypermobile. You can have difficulties with, you know, making sure that you're in the correct positions, because your straight knee might be different to my straight knee because I don't have hyperextension in my knees. Do you know, that kind of way? I think be really careful if you're doing core stuff if you have a hypermobile back, and if you do your core strengthening in a variety of positions. So basically, don't put yourself in a position where your back is really, really straight. Try, and I would nearly work from like a more kind of flexed position into a more extended position over time, because you know that if like your knees are really in tight to you, that your back isn't arching. Basically, I think for people who are hypermobile in multiple joints, it's really important that you are managed properly by your coaches. And if you have access to a physio, be that a student physio or like a physio service for university sport, I think you should really utilize them, because you're potentially going to have different issues and different niggles and injuries compared to people who aren't hypermobile. So I think, unfortunately, there is no one size fits all for any of these, but you in particular will probably need closer attention. Sorry. And then Dad, Clíodhna?
No. I was going to pop to I think this is the next one. Differentiating conditioning between explosive and non-explosive strength. So like heavy squats and explosive box squats rather than one or just the other. So 100%. When kind of looking at that, you would think your heavy loading would be more for your absorption. So that would be like your landing, and then your explosive is obviously when you're leaving the bed, you need that strength. So definitely a combination of both. If you're looking to kind of make a program for that, what you're looking at is your loading exercises and then plyometrics. So they tend to be lower in number, less weight, tend to be body weight, and as explosive as possible. So it's to do with the muscle fibers. I'm going to try and not go too in depth into this because I'm hoping I don't explain it wrong. So it's your muscle fibers, fast twitch and slow twitch fibers. And if you don't train both, then you're obviously not going to be able to use both as well. So when you're landing, it's more your slow twitch, and when you're pushing off, it's your fast twitch. So yes, train both. I think that's all of them.
Okay.
Unless anyone has a sudden question.
If not, thank you so much, guys. We really appreciate this talk. It really, it's been so informative, and honestly learned so much from this. So thank you so much. Really appreciate it, guys.
No problem. I have our email addresses just there, or if you have us on Instagram or whatever, feel free to message us if you need some guidance.
Perfect.
All right.
Okay, guys, I'll leave it there. Thanks again. Hopefully see you at some of our other workshops too. Okay.
Bye.